Hindi team. Now it is the time for the English session. Today is our 2086th day of continuous webinar. Thank you all the participants for joining with us. Before beginning the session, we'll have a silent prayer. Thank you and welcome once again for our 2086th day of continuous webinar. Thank you all the participants. Welcome once again. And today's our speaker is Dr. Jayant Rughani. He's a consultant homeopath and associate professor in the Department of Organon, RHMC, Rajkot, Gujarat. After his BHMS, he got training from ICR Mumbai. Today, he is going to talk about the scope of homeopathy in geriatric patients, especially in advanced medical conditions. Dr. Jayant, you are most welcome to IFPH forum. Now you can start, please.
Thank you, ma'am. Thank you. Am I audible?
Yes, audible.
Okay, fine. This was a kind of first experience for me to treat a patient of 97-year-old lady.
97?
Yes. If I share the background.
Yes, you can share your PPT or slides now.
Okay.
Yeah, started sharing.
Before I start, I would like to acknowledge the teachers and gurus who have inculcated me with all the virtues and who has trained me and who has made me competent to deal with such type of patients. And these people are obviously Dr. Samuel Hahnemann, and after that, my gurus, Dr. Kumar Davle, Dr. N.L. Tiwari, late Dr. N.L. Tiwari, Dr. Bipin Jain, and Dr. Praful Barwalia. All these people are from Bombay ICR, which I had joined in 1998 and I had completed it. And then after I have been practicing in Rajkot, along with that, I am finding echoes. Are you finding echoes?
What, sir?
Echoes.
Sir, it is
no, because you are joined from two systems, from the computer and from the mobile also.
You may kindly
unmute
one for only in
Otherwise,
one.
you can keep the mobile away from you.
Okay. Right now, is it okay?
Yeah, for us, there is no problem.
Oh my God.
And one more thing, your face seems blurred, maybe because of the camera or from because of light. I don't know.
It is because of lights.
It's okay, sir. It's okay. Yeah, I switch on that light. I think you have switched one light.
Wait. I'll remove the cover. Sorry.
Yeah.
Yeah.
And now it is clear.
Oh.
Before it was like.
Okay.
Now you can start, sir. Please.
Okay. First of all, let me give you the brief idea about the disease, which I have so far understood. And I would like the people also. Still, I think echoes are coming.
Yeah, because you have joined from two systems, right? From the mobile and from the.
No, I have not joined from mobile.
Have you? I have seen that.
Two Zooms are open. Would it be because of that?
Yeah. If you are joining from two system means the echoes will come. For you only. For us, there is no echo.
Okay.
And if you are, please leave from the mobile and only. I have seen two Dr. Jayant from.
Workouts. Okay. It was from Google. Right. Now it is okay.
Okay.
So I would like to share the basic idea about the disease development, because if we understand that how disease evolved and uh, according to organon, then probably along with the modern science, modern pathologies, then probably we would better understand this pathology. We would better understand the patient's condition, and then after we will have a thought for the solution. So a brief journey from case to concept. What we learned from this case. Are we learning the case or are we learning the concepts? To begin with, what is disease? How does it originate? How does it make progress or evolve? What is the role of time in all these things? And where does it end? Because we are dealing with a 97 years old lady. So I think it is, I request all the people, all the candidates, all the participants to think at that level and then after act. The answers, the origin from predisposition, then disposition, then diathesis, then disease. This is how the disease evolves, right? Progress. How does disease progress? It starts from invisible area. It starts in the mind. It starts at the vital force, which is absolutely invisible. So in the initial part, it may be invisible. When it makes visible, it must have passed through various phases. So that's why, can you see my arrow?
Yes, sir. Yes.
Okay. So if you look at this part, this is absolutely clean. There is nothing is mentioned. Then after first dot, then after two dots, then after three dots, then after four dots, then a small line, then a big line, then three lines, right? This is how I would like to demonstrate the disease evolves from the invisible state and it makes visible to us gradually and gradually. It becomes larger and larger. Initially, it is organized, and at the last phase, where what we can say the cancer or syphilitic area, where it becomes disorganized. So that's why in the last column, then the last figure, last picture, I made it scribbles. So it progresses from invisible to visible. It progresses from spirit to matter. It progresses from imperceptible state to perceptible state, functional to structural, structural reversible to structurally irreversible. From SORA, journey goes from SORA, then psychosis, then tubercular, then syphilitic, where it ends. Initially, you will have uncommon or individual symptoms. As disease advances and it is suppressed, you will find more and more common or diagnostic features. Now we start with the case. The patient was born in October 1923, and the first interaction on phone was done on 5th October 2019. And then after I had made a visit to this patient to her home on 8 January 2020. Age was 97 years, female. She was widow since many years. Her spouse was a civil engineer and expired many years ago. She had 4 daughters. Daughter 1 expired long ago. Daughter 2 married and now she is settled in USA. Daughter 3, she got married to her elder brother-in-law to take care of her children. The purpose was just to take care of their children, which continued for this marriage continued for years, and after death of brother-in-law, she returned to her maiden home and then did not marry again. Am I audible? Okay, fine.
Yes.
D4, the youngest daughter, she remained a spinster and lives with mother and daughter 2. The son, only son, who is an engineer, he is married to a gynecologist and settled at USA since many years. Daughter-in-law is MD Gynec and working at USA in hospital. Grandson 1, optometrist. Grandson 2, engineer and is very genius person, has received handsome scholarship from US government. So why I'm sharing this, because the patient is coming from a well-educated family. And she is living with two daughters, D3 and D4. And both these females are unmarried. There are only 3 females living at Rajkot in house purchased by the son, while only son who is at USA. Whole family is highly engrossed and devoted in a well-known religious Hindu sect. So there is a complete religious diversion. They are absolutely for all the time, for whole day, they remain busy in religious activity only. D3 had a job in private college and now retired, and she was my patient. She is also suffering from diabetes mellitus, and she brought this patient to us, mother to us. D4 is also living together. Family history. Daughter 3, she had type 2 diabetes mellitus and irritable bowel syndrome. Daughter 4 had history of pulmonary tuberculosis. Daughter 2 is suffering from migraine and also has IBS. The past history of this patient. In 2007, ECG report is available, which shows right bundle branch block, 2D echo normal. 16th January 2007, carotid Doppler was done, wherein it was found out in the left side calcified plaque at the anterior wall of the distal common carotid artery and its bifurcation. Present history with ODP. And all these things were taken on the phone calls. And you can understand 97-year-old female patient, she could not come to the clinic. So everything, whatever history, whatever data I had to collect, that was only on the phone call. On 5/10/2019, the daughter complained of my mother has complained of toes and finger joints burning with itching, which is better by cold. So I received a phone call. On phone call, I received this data that my mother is having burning pain in the toes and finger. And she told me that it could be because of insect bite. It could be because of insect bite. So what you can do from this history, I in between I invite the group to interact, because interaction will facilitate the further learning. If you receive a phone call from any patient with these data, what would be your action? Possibly diagnostic thinking. Anyone can participate. And participation would make it alive, would make the session alive. Anyone from the group? Let it be wrong, but if you receive a phone call that my mother, who is a 97-year-old lady, and she is having burning pain in the fingers and toes, which is better by cold application, and it could be because of insect bite. That's what she is saying.
We have
What?
2 comments here, R-Solve and APIS.
R-Solve and APIS. Okay, very good. Anyone else?
Again, APIS.
Okay. Okay, I had prescribed Ledampal 30. But patient was not better. On 3rd December 2019. That means after few days, doctor reported that there is no response at all. Then she complained of both toes and metatarsal joints. She found it red, shiny with burning and tingling inside. with a numbness since few days, which is better by cold pressure and uncovering. Aggravation from warmth. On examination, it was extremely cold to touch. This was reported by daughter. Now, what would you think? What would be the line of action? I am repeating. On 3rd December 2019, right? Here it is a winter, December. Complain of both toes and metatarsal joints. They are red, shiny with burning and tingling inside with numbness since few days. Modalities: better by cold, better by pressure, and better by uncovering. Aggravation from warmth. On examination, extremely cold to touch. Line of thinking as far as disease diagnosis is concerned, as far as your remedy is concerned.
We are getting comments, Rastock, CKL for sulfur.
Diagnosis. What is the problem? Diagnostic possibilities. What are you thinking? Why these complaints are there?
Uric acid, neuropathy,
Neuropathy. Okay.
uric acid deposition.
Okay. That means you are thinking of gout.
Yeah.
What will be the common age for usual age? Usual age for gout.
Age, right? Stasis vascular.
Vascular stasis. Fantastic. So that's the most common thing we can, most common possibilities we can think of. Vascular stasis, because at the 97 years age, what would be the level of blood vessels? Condition of blood vessels. What can happen? We have 26 participants. Anyone can share. And these would definitely make me happy and you also would learn.
Dr. Asha, Raman, Dr. Sheila, they are sending some messages. You can send messages, please. Narrow blood vessels from Dr.
Narrow down blood vessels. Why should there be narrowing? Is it the only narrowing or anything else?
Because of aging, she wrote. Dr. Asha again replied.
Okay.
Dr. Harinarayana Prasad mentioned about CKL4.
Okay. And you prescribe whatever medicine you want to prescribe, CKL cure is prescribed. Okay, fine. Now let's see what happens. You had prescribed CKL core on 3rd December 2019, right? Now you see 19th December, burning, itching in soles at night. One more modality has come up. Burning and itching in soles at night, better by cold water application. Applies local cream as suggested by her daughter-in-law, who is a gynecologist. She keeps her soles uncovered. Other complaint of frightening sensation in heart, which is a chronic complaint, which has been there since many years. So what is the response? You want to prescribe sulfur. Okay, you prescribe sulfur. But now what is the response? Now the treatment is going on phone call. You are getting case on phone. You are treating patient on phone. And you see, you focus on two things, remedy reaction and Kent's 12 observation or Kent's 12 observation. And second thing, second prescription. Both these things should go hand in hand. Then only you'll be able to understand in which direction your case is going on. If you are thinking of vascular stasis, what would be your prognosis? 97-year-old lady. And what is setting in? I request the group to become little verbal.
Sir, actually, while starting the class, we'll mute all the participants to avoid the disturbances. So they can only send the messages.
So whosoever
After-
want to communicate, he can unmute and can share.
So that will take more time. No, everyone have to raise the hand and
Okay. Anyway,
I'll unmute Dr. Asha. Okay, Dr. Asha, you can unmute yourself and talk. And Dr. Sheila and Dr. Harinarayan.
so let us have a 2-3 feedbacks. Then after we would move ahead.
Normally, we'll have a discussion after the class. So
After the class, we will have another type of discussion because this case has 3-4 stages. That's why I'm.
okay. Dr. Asha, you can speak now. Okay. Please. Dr. Asha, you are unmute now. You can speak, please. Okay. And Harinarayan Prasad.
Is there anyone to want to?
Dr. Harinarayan Prasad, you are also.
Dr. Asa wants to share. Please, you share. You unmute yourself and then after you share.
Dr. Asha, please.
Hello, can I speak?
Yeah. Yes.
Is it audible?
Yes.
audible.
Fine.
Yes, sir. I feel that she might have developed cellulitis if she's not treated properly.
Very good.
Burning, itching in soles at night, amelioration by cold application, all those things are manifestation of neuropathy condition also.
So in this condition, what will you do?
We have to. I think for me only the sulfur comes into mind, sir.
How will you come to know whether it is a neuritis, whether it is vascular problem? How will you come to know?
That we have to understand only by the set of the symptoms that patients are reported, patients' attenders have reported.
Is there any option? Any other alternative?
Last visit you mentioned that it was cold to touch. That indicates that there might be some circulation problem, but in the 2019 in that visit it is not mentioned. So I feel there might be some improvement by the medicines.
Anyway, anyone else wants to share anything, or may I go ahead?
Okay, you can proceed, sir.
Okay, fine. So on 6th January 2020, D3 asked me to make a visit, and PP suggested to primary physician suggested to carry out some investigations. Now, which investigation you want to order? Why do you want to investigate this case? What do you suspect? To whom you are supposed to consult? Now you see the reports. I asked them to consult a vascular surgeon, which is the nearby, whose hospital is nearby their residence. And vascular surgeon reported, and he has mentioned, clinically critical limb ischemia. This is the report given by the vascular surgeon. And he has mentioned in his notes, in his paper, clinically critical limb ischemia suggestive severe arterial obstruction. Right? Coronary wedge pressure. It is a pressure measured distal to totally occluded coronary artery. It reflects the pressure in the coronary microcirculation and collateral blood flow. In the report, these abbreviations are mentioned: CWP, ABR, anklo-brachial ratio. What these reports mean to us, we will see later. These are the short forms. Why CWP is important? Why ABR is important? What is the clinical significance? Because now the things are clear before us that there is an arterial occlusion, severe obstruction. These are the normal range of ABR. Okay, now I'll share another slide. Just a minute, wait. To remove this, what I supposed to do? Can you guide me? If I want to change this. Stop sharing or post sharing? Hello? Dr. Ajinmaya.
Yes, sir. Hajini.
Sorry?
Ajini.
Ajini. If I want to stop sharing this, okay, fine. I got it. Stop share.
Yeah, stop sharing. You can.
And now another. This is the original note. Is it?
Sir,
Can you see
original
this?
note. Have you opened the original note? We can only see the. I mean, the other screen. Have you opened the original note?
Yes, I have opened.
But we are not seeing the opened one. We are seeing only your documents. Like once
Okay.
again, you can share.
Now?
Yeah, now varicose vein both.
Okay. On examination, it was found out that there was a. Okay, just wait. Before that, let me show you the reports. Can you see the report?
Now, same like before, we are seeing the documents, not the details.
Just wait. Now?
Yeah, now again, we are seeing the document.
Report is not available?
Yeah,
It
report.
Is it visible or not?
Visible.
Okay. You see this report?
Yeah. Name.
6th January 2020. Clinical impression, bilateral lower limb, critical limb ischemia, CLI. I am reading this report: bilateral lower limb, critical limb ischemia with redness and cyanosis. Right? Clinically, bilateral femoral palpable downstream. Downstream, not palpable. Bilateral femoral palpable, downstream, not palpable. Coronary wedge pressure, bilateral superficial femoral artery block with vasculitis. Is it clear? Hello.
Yes, yes.
Yes, sir. Yes.
So now can you understand the gravity of the situation? Hello.
Yes, yes.
Yes,
Yes.
sir. Yes.
So you are, or we people are dealing with what type of case? Bilateral superficial femoral artery, which is blocked and it has caused vasculitis. Where it is blocked, how much it is blocked, the patient was given all these medicines, right? And after this report, you see, ankle CWP, right side popliteal, posterior tibial artery, no signal on both the sides. Anterior tibial artery, coronary wedge pressure 110, here 100. ABR, anklo-brachial ratio. Here it is 0.64, here it is left side, it is 0.58. These are the clinical impressions. I just want to draw your attention, but the diagnosis is clear. So we are dealing with a bilateral superficial femoral artery which is blocked and it has caused vasculitis. Hello?
Yes, sir.
Okay, fine. So I'll stop this and then so after that, patient called up her daughter-in-law who is in USA. Daughter-in-law said, in this condition, homeopathy can't do anything. You have to go for allopathy. Otherwise, you will have to ampute the legs. The vascular surgeon suggested that you try out with these medicines. Otherwise, if it does not work, then you will have to go for the amputation, bilateral amputation. So can we understand the gravity of the situation now? At this age, if someone has to undergo amputation, what would be the mental condition? So then daughter-in-law suggested, we don't have any trust on homeopathy. You please go for these medicines. Patient took these medicines for a couple of days. It was prescribed on 6th January. Patient took it from 6th and 7th January. And on 8th January, I received a phone call. Doctor said, my mother is crying, literally crying, and she is saying, I cannot tolerate these medications. I would prefer to die, but I don't want to take this medicine and I don't want to ampute the legs. Let me die. If our grandmother says like this, what option do we have? So in a no choice situation, patient came to us. Then how much equipped and trained we are to deal with such type of cases. If we don't give any response, if we don't give any benefits to these patients, in very short span of time, it will lead to gangrene because there is complete obstruction. And then only option left is amputation. So doctor said, you please come to home. Then I made a visit. Now I'll share the visit note. This is the original visit note. I have not done. Is it visible?
Yes, sir.
Okay. So this is original visit note. The moment I entered the home, the patient said, still you want to earn money from me? How much you want? See, physician's observation, physician's welcome, response, everything is counted in homeopathy. Right? Then clinically, whatever data I could gather, I'm sharing. Left side, there is a pain. aggravation, tumor at night, especially between 9 to 10 p.m. This causes sleeplessness. Pain as if from suppuration, as if pulsation, as if sparkles of fire in toe. इतनी जलन हो रही है कि मैं सहन ही नहीं कर सकती. Burning of skin, feet pain, better by pressure. Even with a pressure of clothes, there is negative modality of node aggravation from hanging limbs down. Left foot, two toes, especially second and third. I'll show you the picture also, image also, which I had taken. Left feet, two toes, left foot, two toes, second and third toe, better by cold water application and aggravation by hot water application. On examination, both the feet especially found cold to touch. Right foot, in left foot, second and third toe, in right foot, fourth and fifth toe. These two toes were affected. Feels cold. Earlier it was in the left side. Now since few days or since 3 days, it is on the right side. There is a complaint of burning, 3-mark burning. Daughter said she cannot tolerate fan air. Her bed is in corner and fan is in middle of the room. So then also she cannot tolerate fan air, draft of air, but she likes cold. She cannot tolerate heat also. At the same time, she wants fan or air from the distance. She doesn't like direct flow of air. Overall, patient said she cannot tolerate heat. Heat is very difficult to tolerate for her. She said in this cold season, in winter also, she would like to put off her few clothes, saris, and she lies in the blouse and the bottom. And for the covering, she takes only one rajai. Clinically, if you see the development of the disease, in the left side, it is there since 1.5 months, and since 2-3 days, it has captured the right side also. So this is the clinical notes. Is it clear?
Yes, yes.
Okay. Now you can you gather something on these data? What do you want to do? Try to understand the gravity of the situation and then act. Give me the totality and remedy. Please contribute. Someone said lecasis. Arsalb, epicyclic or sulfur. Okay, down the line. Okay, Dr. Sheila, lecasis. Anyone else? I cannot see anyone's face, even not mine also. So now what to do? Our grandmother is in this situation. And doctor advised to ampute the legs. The report is there in front of you. You made an attempt to take the data. The data is available. Differentiate the data from common to uncommon. Raise the totality and come to the medicine. Other possibilities? See, if we don't treat this patient within a couple of weeks or within a week or couple of weeks, what can happen? You can understand. I'll show you the photographs. Let me show you the photographs. Is it visible?
Yes, sir, visible. But can you please click the pictures or so it will be.
What can you see on the screen? Can you see the photographs?
Yeah, I see. I'm seeing all the photographs, not clear.
Not clear.
No, sir.
I mean, you have to click one by one.
Yes.
Okay. Okay. Can you see this?
No, you click the picture, but it's showing.
Okay, wait. Once again, I share. Now,
Now visible.
see, this is left side. You see the toes. Okay.
Yes.
I'll show you another photographs. So these photographs now, can you see?
Again, we went to the document.
Okay,
with
fine.
all
Fine.
photographs.
Now,
Yes.
so investigation report is already available, which is given by the vascular surgeon. So there is no doubt about internal pathology. I'll show you another photograph. This was left side. Now, can you see this?
Yes.
See the discoloration? Okay. Just a minute. Now this is right side. Wait. Now,
Yes.
this is right side. So both sides are affected. So what to do now? I show you this varicose veins also.
Yes.
Yes.
Can you see this?
Yes.
So now what to do? Dr. Rajini, Dr. Ganesh.
Yes, please put forward the symptoms first, sir. Then
Case note is available to you, sir.
Yes. Then you might have heard about the case already. You told about the case and about everything and aggravation, amelioration, everything was discussed. So you choose the symptoms in the order and then try to find the remedy as per the.
Okay. So what is that?
Yes.
You are thinking of what?
Oh,
Do you want me to once again present the original case data? At the last, I'll share the actuality. At the last, I'll share everything, whatever I have done.
Okay, that's good.
But before that, just let me have the feedback of the group that if you would have been in the situation, what could have been done by you?
Actually, in those conditions,
What could have been the line of action that you might prefer?
actually the case itself it can be racusis process like that, but we have to differentiate those things. Those things are called precise carbo, which is also coming over there.
Okay.
So many medicines are coming, but we will have to find what is rare in the patient. That you can get by if the patient is not able to talk to you, you can just solve the bystander and how she reacts to the situation, whether she is taking food or what kind of food, like that. And even what is her reaction, even if how she reacts to the pain.
Sir, in this situation, which approach would you like to prefer to crack this case?
In these conditions, you can go pathological suspicion. That can be the best method. What I
Alright.
feel so. But after that, you can choose
Very good.
constitutional remedy as per your.
So which approach?
Yes.
Which approach? In this pathological case, who
Patho-
has
Yes.
which approach would you like to take?
You can go with even with my asthmatic also, but things are different here because age is critical. The patient is very old, and the response is also not much good.
Dr. Jayant, it is
Okay, fine. Let me
pathological
share.
prescription. Everyone is telling the same thing. You proceed with
So
that.
what I mean to say, uh, uh, approach in the sense Kant, Bonigusen, Boger. So anyway, I had taken Boger's approach to crack this case. Okay. So in which potency would you like to prescribe? Whatever medicine you choose, which potency and how would you like to prescribe?
It is better to go with the low potency because the patient is old.
Okay.
And you can even repeat the same as and when required. That's what we.
Asha also mentioned the same.
Okay. Fine. Fluoric acid, pathological prescription. Is it visible? Can you see some slides on the Boger?
No.
Now?
Yeah, started 5 minutes of individualization in Boger's approach.
Right. Concept of time and evolution. You see in what Boger has given importance to what? Modalities, pathogenesis, tissue affinity, discharges, and sensation. Homeopathic concepts used causation, tissue affinity, clinical, pathological correlation, complete symptom, original unmodified picture. So Boger has given us the idea how to crack this case, these type of cases. See here, you can't take help of craving aversion or the entire mental history, because 97-year-old lady in this situation, when she is not ready to communicate to you, unwillingly she is giving the history. So in that situation, what can be done? That's why in the I started my presentation with the disease evolution. When disease has reached to certain state, what types of data you can utilize. So on this ground, I had proceeded ahead. So I had prescribed lachesis in 0/1 50 millisiemel potency. The reason behind it is the sensitivity was high, but the susceptibility is utterly low. Can you hear me?
Yes.
So I had started lachesis 0/1 TDS 3 times a day in distilled water, or you can say in boiled water. And in few days, patient said, 2-3 days, patient said, doctor said that now my mother could sleep for whole night. But the discoloration is still same. The complaint of burning, which could not allow her to sleep at night, that has gone. So what I mean to say, if remedy and potency both are not perfectly chosen as per the demand of the case, the response, such type of response cannot come.
Yes.
And eventually it will lead to gangrene and it may lead to amputation. If it is not, if response doesn't come in time, she may have to face this amputation, because it will not take time to proceed. It will not take time to flourish, to progress, to complicate the case. When your susceptibility is in lower zone, the age is such, the condition of the vessels, atherosclerosis, arteriosclerosis, and then occlusion. So with that, the gradually patient improved. If you want me to share the reportization, I'll share it. Just a minute, wait. Just, in between, when they had gone to the vascular surgeon, at that time, doctor told me, the doctor, could it be possible that once mother had stricken her toe to the leg of bed, and that might have caused to this thing? Doctor anticipated and given me the cause. Now you see the reportation, I'll show you. Just can you see this?
Yes.
Now correlate with the Boger's concept. What was the Boger's concept? Tissue affinity. Which tissues are affected? System, organ, heart, and circulation. Blood vessels were affected. What has happened to them? Inflamed phlebitis, congestion, history of injury, generalities, old age, senility, complaint of swelling, thrombosis in lower limbs. In general, thrombosis, most individual parties, it started from the left and then it has gone to right, better by cold application, night aggravation, sepsis, and the confirming concomitant is patient could not tolerate fan air directly. Patient wanted a fan from distance. The patient is hot. So that's why Lachesis 0/1 was prescribed. And within a few days, the generals started improving. I'll show you the another photographs of this patient. May I show you the last one or all the photographs which had occurred in between?
We have 3 minutes more, sir.
So last one I'll show you, the last one. Okay, just can you see this?
no, sir, not yet. Started share. Yeah, now started.
Now, can you see this?
Now seeing the documents, please click the photo you want to share.
Okay. Okay. Now,
No.
The
Wait.
file is not open, sir. What you need to do is just to close the file and then open the
Okay.
file again.
Oh,
Then
oh,
only it
okay.
will be visible.
Okay. Now,
Ah,
Yeah.
yes.
Yeah. Yes.
now you see this is a condition of left foot on 19th August 2020 after 7 months. I'll show you the right leg also. Just a minute. Can you see the right one?
Yes. Yes.
Can you see the difference between these two conditions?
Yes.
So this is how we can unfold the scope of homeopathy in geriatric patient, especially in advanced pathological condition where if it remains untreated or care is not taken, what kind of grievous situation we may face. So hats off to Honeyman and lots of thanks to Honeyman that he offered this science to us and we could, implement a bit to our patient. Thank you. Thanks a lot.
Thank you so much, sir. Hats off to you also. And I'm appreciating your courage and confidence to take up these cases, even though the patient has insulted you, like you are coming for the money, even though you have taken the cases. Some doctors they feel bad and they don't continue the cases. Okay, as you wish, you can treat. Likewise, we don't take the case. And you proved that you are a organon teacher. I felt that I felt that I'm sitting in the class, right in the classroom, not in the
Oh
Zoom
my
meeting.
God.
Thank you once again. And now we have to start the another session. Thank you on
Sure,
behalf
sure.
of IFPH, and love to hear your classes. Come again. Thank you. Bye bye.
Thank you. Thanks a lot. Thanks a lot.
Close the screen sharing.
Okay, fine.
And now I'm handing over the session to Dr. Mariamma Jo
Yes,
for
before
moderating
that,
Malayalam session.
yes, before that, there is an announcement for tomorrow. Tomorrow, there will be a session from Dr. Remadevi Ambadi, and doctor will be talking about infertility and homeopathy, and some of her cases will be presented. And that's what for tomorrow. Hope all of you will join for the session tomorrow also.